morning. Thanks for joining us. For Local 3 News, I'm Brianna MacLean. Following new CDC recommendations, Michigan Department of Health and Human Services says they are updating their quarantine guidance for coronavirus. The CDC recommends a shortening of the quarantine and isolation duration for those who aren't vaccinated or haven't received their booster to 5 days, followed by an additional 5 days of wearing a well-fitting mask around others. The updated guidance is specific to the general public and does not change the current guidance recommendations for get-together settings. Early child care or K-12 settings, these settings should continue to use existing guidelines and policies regarding quarantine and isolation. Guidance will continue to evolve as more information is learned from CDC. In other news, the state of Michigan is joining 21 other states in allowing other healthcare licenses around the country to be recognized in its state. For example, this could benefit UP communities along the Michigan-Wisconsin border. Our CBS affiliate WSBT has more.
This applies to nurses, physicians, and anyone licensed under Article 15 in the Michigan Health Public Code. Healthcare workers from across the country, whether they share a border with the state or not, can help provide worker flexibility in the state of Michigan.
It really just solidifies some flexibilities that we've had in place since the start of the pandemic to allow individuals who are licensed and in good standing in other states to come and work in Michigan without first obtaining a license.
Carlson says the Michigan Health and Hospital Association, or MHA, has been working on this for several months now. In recent weeks, the state of Michigan has been one of the hardest hit states from the pandemic. The MHA says there are 875 fewer staffed beds in the state compared to this time last year.
We're very excited because the bill really has very limited requirements. We wanted to make it as easy as possible given the massive shortage we have right now of healthcare workers.
Spectrum Health Lakeland is among the Michigan hospitals to benefit from this new bill, saying, similar to hospitals across the nation, both our staffing resources and overall census capacity are being stretched extremely thin. The bill goes into effect immediately, and Carlson says hospitals are hoping the new flexibility for workers can help fill open positions, so they can continue helping patients during the pandemic.
It's been critically important as we face massive healthcare worker shortages across the state to allow individuals coming in to be able to immediately start working and caring for citizens here in our state.
The House also passed a separate bill including $300 million to attract and retain healthcare workers in Michigan. The Michigan Health and Hospital Association hopes the Senate passes this bill in January, where it will then take immediate effect.
Not as cold today as we're looking at temperatures in the 20s and 30s. Could see light snow or a light wintry mix. Snow and wind tonight and Wednesday, and heavy snow and blowing snow is possible that could create difficult to very difficult travel. Keep up to date with this latest round of snow coming in on our webpage, upmatters.com.